All right, y'all, welcome to Take Charge Tuesday. Thank you for coming. Very fortunate to have Miss Cassandra Seal with us today from Helen Keller. She's the director of the Breast Health Center there. So we're very fortunate to have her come out and talk to us about breast cancer awareness today. And why this is Breast Cancer Awareness Month. Few housekeeping things for the people online that are Zooming. If y'all can put RFW in the chat, then we will get your attendance. And then we've got your sign in here. If y'all haven't signed in, make sure you do so that we can record your attendance. And then we'll push an evaluation out online for all of you who are Zooming. And then we have an email that will come out to our face-to-face group. So since our sessions are quick, I'm going to turn it over to Ms. Seal, and she's going to educate us on breast cancer awareness.
All right. Well, thank you so much for having me today. It's probably been a couple, I don't know, we've been doing this COVID thing for probably 2 years now. So we probably haven't had anything like this in a while. So it's been a few years ago, and it was over in,
It was in the GUC.
Yeah, the GUC was right. Did anybody come to that by chance? Okay. All right. Well, thank you so much for inviting me to come today. I'm not so much of a public speaker as I am just somebody who's just passionate about what I do. So I'm very fortunate to come and share with you all today some of what I've learned in my career and through our program about breast health. One of the really cool things that I get to do are talks like this. So, we just dream about this perfect world where everybody knows what their risks are and we catch breast cancer early and everybody knows the signs to look for and stuff. But, we know that's not really true and that's not always practical. So it's good to come out and just share some just informational things to hopefully catch breast cancer or risk factors on the front end before a diagnosis, or at least catching breast cancer at the earliest stages, and just really use the time to clear up some common misunderstandings and myths. So I am the director of the breast program at Keller. We have had this program for probably, I think, 6 years now. And we do cover everything from pre-screening and community education, prevention type things, all the way through survivorship for breast cancer patients. So I'm just going to, I appreciate everybody coming today on your lunchtime. I hope you've had a chance to eat already, but I'll kind of roll through it. And I don't like to really just talk at people. I want you to, if you have questions or anything, if you want to stop me, I'm totally fine with that. I like for it to be a little more interactive. Hitting the arrow here and it's not going over. Try clicking that. Sorry about that. So just an overview of what we'll talk about, just a general overview of what is breast cancer, what are some of the risk factors, some prevention and early detection strategies, a little overview of benign breast disease, and then I'll give you kind of recap where our nurses fit into that process for our patients. So breast cancer is, we know, very common. I think we all, if you haven't personally been affected by it, you know somebody who has. So it is a very common cancer type in women. 1 in 8 women have a lifetime risk of developing breast cancer. It's the second leading cause of cancer-related death in women in the United States. And then you see there the 1 in 8. That's for average risk. We do know now we've identified some genetic mutations and different things that put people at a much greater risk than that, and they have double instead of a 12%, it's more of 20, 30, and sometimes we can identify some mutations that almost certainly tell us they're going to get breast cancer. So all of that is great. The benefit of having so much volume of breast cancer is that there's funding behind that, there's interest behind that, there's so many people affected by it. So then we're constantly doing research and coming up with new ways to identify different things to detect and treat and prevent breast cancer. Just kind of a general anatomy overview of the breast, just to say that breast cancer can develop in any part of the breast. The most common types that we see develop in the ducts or in the lobules, but they can, it can be on the skin surface. We have, there's a certain type of breast cancer called inflammatory breast cancer. Breast cancer doesn't always come in the form of a lump, so we'll talk through some of the different types of changes that you may see outside of a lump. But just a little visual also to show you that once breast cancer starts to spread, it travels through these lymph nodes underneath the arm and then out to other parts of the body. And basically, what is cancer or what is breast cancer? Just an overgrowth of abnormal cells. And most of the time, we don't know. And when I say we, I mean like worldwide, we don't know why breast cancer happens. It's being a woman and getting older are the two main risk factors for breast cancer. And that's something we can't do anything about. So typically it happens and you can never really pinpoint a reason why it happens. We do usually see it in older women. We're dealing with a different cancer, breast cancer type, and a little more aggressive situation when we have younger women who are diagnosed with breast cancer, but it happens. So you're never too young. You know, we don't recommend annual screening for people in their 20s if they haven't been identified as a high risk or they just don't know that they're a high risk. But I've lost a friend at 24 to breast cancer. So, I mean, it happens. And she was told by her provider at the time that she was too young for breast cancer and that lump she felt was probably nothing. And then a year later, you know, we finally decided to biopsy and it was breast cancer. She's since passed away. So I always try to kind of stress that we don't know why it happened. We diagnose people with breast cancer and they say, I don't have anybody in my family that has breast cancer. And I'm like, you know, most people don't have, I mean, believe it or not, they don't. It's one of those common, I think, myths. Is that most people don't have a family history. It's just one of those things that happen. So some of the, most of the causes, like I said, are unknown, but we do know of certain things that have been identified that can cause breast cancer or definitely increase your chances for getting breast cancer. So some of those risk factors are gender. We know being a woman puts you at a greater risk. Unfortunately, we can't change that. Aging, like I said, the older you get, the higher risk you are. Genetic risk factors and the family history of breast cancer. And we get sometimes a lot of people that want to start their screening at a much earlier age, and we just try to, because they say they have a family history of breast cancer. But if it's, you know, my grandmother was diagnosed at 80, we don't consider that really at an increased risk. But if it's my mother died at 35, or my sister and my other sister, or if they've had one male breast cancer, then we look, that's a huge red flag. So we just try to educate them that, you know, because there's so much anxiety behind breast cancer, because you do hear about it so much and there's some real fears there. So we just try to kind of clear that up and let them know, okay, when you're at high risk, it's multiple first degree relatives, and at least one of them needs to be like under the age of 40 for us to consider that a high risk for like genetic mutations. If you've had a personal history of breast cancer or maybe precancerous cells, there are also had another friend that passed away from metastatic breast cancer that was treated with chest radiation as a child, something they used to do for a lymphoma that was found in children at the time. They don't do that anymore, but those high doses of radiation put her at a much greater risk for developing breast cancer. And she did develop breast cancer, and then it actually came back. And so, and then postmenopausal hormone therapy. Most of the breast cancers that we see are fed by our female hormones. So estrogen, that's something we always check every breast cancer diagnosis for, is estrogen and progesterone receptors, to see if, basically, and an easy way to say that is if that estrogen is fueling that cancer. So people who have been, especially on extended postmenopausal hormone therapy, they're taking hormone replacement pills, pellets, things like that, can put you at a greater risk for developing breast cancer. Long-term use of hormonal contraceptives can also affect that race. We do see in the Asian community, there are some different breast cancers that are a lot more common. Also in the African American community, we see a lot more in younger women, what we call a triple negative breast cancer. So it's not that typical breast cancer that's fed by those female hormones. there are no hormone receptors, so it's really hard to target. So for the hormone positive breast cancers, we have special medications. Some of you may have heard, like tamoxifen. It's a little pill that people take for like 5 years after their breast cancer. So when you have a triple negative breast cancer, then that's not an option for you. So basically, less treatment options for that. It's a little harder to treat. Chemotherapy is the first line defense for that. Dense breast tissue, obviously you've heard a lot of talk about that. We actually have a law in the state of Alabama that says if you have dense breast tissue, your provider is supposed to make you aware of that, and they're supposed to talk with you about additional screening options for you. You can see just this kind of gives you a visual as to why it's so important to know that, and to also accompany other imaging modalities along with your mammogram to try to catch that breast cancer, because this is a really dense breast. You can see it's very busy. Well, it also, cancer shows up white on x-rays. So if you're trying to find a small or even a large breast cancer sometimes in a really dense breast, it's like trying to find a needle in a haystack. So we do have just updated this year to top of the line 3D mammography, which is really good for looking at dense breast tissue. But in a lot of cases, you need to talk with your provider about having an ultrasound as well, so that so it looks at the breast obviously in a different way, and they can look to see if there's any little nodules in there, if it's just fluid-filled cyst, or if it's a solid tumor. So it's always good to just know if you get your mammography report in the mail and it says you have dense breast tissue, which it should note that if you do, and your provider hasn't talked with you about it, then just reach out to them and say, hey, I got my letter in the mail. What can I do about that? So I also brought because it's such a common thing people have questions about, I brought some different educational pamphlets, some of the more common things, and there is one specifically on dense breasts. Some other risk factors are obesity, alcohol use, not having children or having them later in life, and all that is just chalked up to the hormonal changes. If you have a higher level of hormones for a longer period of time, or just say you're later in life and you get pregnant, that increase in those female hormones at a later age can obviously affect that. And then if you have more menstrual cycles, somebody who was to start at a much younger age, then they've been exposed to those increase female hormones that can fuel those breast cancers for a longer period of time. And we just want everybody to know their risk, know what your risks are. You know, so many OBGYNs now and primary care practices offer genetic screening and testing. I had it very easily, didn't cost me a penny, through my OBGYN. So a lot of them now have started just doing like a simple screening when you go in, but especially if you know that you do have some type of family history, or you feel like any of these other risk factors would apply to you, I would definitely talk with them about what your individual risk is. I'm a huge, I just love to know that people know what their individual risk is, because this is not a one size fits all. And we do have national guidelines, so when we should start our screening and how that should go and what that should look like, but that's just for average risk people. So know your risk, and you may fall in a category that you are a high risk, and therefore, that would get you on a tighter screening plan, so that if you're at increased risk, you're going to be getting screening every 6 months instead of every year, so that you can hopefully catch that at the earliest stages. Just some kind of preventative measures, common things, and you all are in the world of wellness and health and exercise, and I'm sure you tell this to your students all the time. Just kind of common, get to and stay at a healthy weight. Be physically active, limit your alcohol use. So all those things are, that's a true story, and you kind of hear it over and over again. It's a lot easier to say than actually stick with, but those are just some, you can do all those things and still get breast cancer, but the best way to try to prevent really any cancer is to, watch our diet, stay physically active, limit things that are toxic to our body. And then if you are postmenopausal, whether you have had a hysterectomy at a younger age or whatever, you could, definitely dig into what your risks are before you think about taking some sort of hormone replacement therapy. So that's something that you could look at, maybe some alternatives to doing that. Including the breast imaging though in the screening, I like to just put this little visual on here just to kind of show you, what mammograms can detect versus what you're going to feel on your own time and your own exam. So just, we see 3 and 4 millimeter cancers on mammogram, and I don't care how good you are at clinical breast exams, some of those little nodules will just never be felt, and especially if they're deep in the breast. So this just kind of gives you a visual of how important it is. There are, a lot of myths that float around about mammograms. There are people who are scared to maybe know what they're going to say, or they're scared of the radiation, and different reasons why people don't want to come. But we've seen too often that somebody waits until they're actually having a problem. And oftentimes they've got this, strawberry size, golf size lump that they've picked up on, and then they want to come and have the mammogram, and then it's, too late. Cancer has already started. So just a little visual that I like to share on that. Some of the different breast cancer screening options, and something you could talk with your provider about, especially if you have dense breasts, is doing a mammogram in combination with an ultrasound. And we do offer all types of breast imaging at our center. We do the 3D mammograms, we do ultrasound, we have breast MRI, we have a test called molecular breast imaging, and ultrasound. I think I already said that. And we are an accredited breast imaging center of excellence, which I like to point out, which means that they really meet the highest standards of they kind of go, they do go above and beyond the typical standard with the American College of Radiology to be able to get that certification. So mammograms, though, we say between the ages of 35 and 40, average risk people can come in. Your insurance should cover it for you to come in and have what we call a baseline mammogram. If everything looks good, then we'll say, we'll see you when you turn 40, and we'll see you every year as long as you're in good health after then. So if you're between the ages of 35 and 40, or you're over 35 and you haven't had your baseline, then you should certainly call and try to get that scheduled. Clinical breast exams are very important. More often as you get a little bit older. Breast MRIs are only used on high-risk patients, people who've been diagnosed with breast. It's not a typical just screening tool that we use. It's very expensive. It's very timely. It's very sensitive. There can be some false positives that come back from that whenever you're just using it for screening purposes, but it is a really great way to look at the breast, especially if you're a high risk, and in certain breast cancer situations, we'll do an MRI. And then the MBI we have that is really good for looking at dense breasts too. I've got just a quick little 2-minute video here just to kind of walk you through, just to kind of walk you through how to do a self-exam. There is a method to that. I think if you're doing anything to stay self-aware, that's a good thing. But there really is a pattern and a method that you should use to really, for that process to be beneficial to you. So I think this lady does a great job explaining. It's like a 2-minute video. And we'll watch that real quick and then move on.
I'm not sure why it's not transporting over, but the viewers online are able to see this.
They can? Okay.
Yeah, it's not transporting over.
Well, we can skip through it
Okay.
if it won't.
I apologize. I don't know why that's
No, it's okay. So really just to summarize what she's going to say about how to do a self-exam is, we can scoot over to the next slide, and that actually might help. So there's really 2 different parts, looking and feeling. to a self breast exam. It's really good to pick a certain time every month to do that. You want to use the pads of these 3 fingers. I oftentimes will do some little classes, how to do a self-exam, and sometimes it's with like even younger. Sometimes I'll do some stuff at the high school and they just start poking around like this, with the fingertips. And so fingertips are not that sensitive. And if you're going kind of straight down, then you're going to miss a lot of tissue. So in the video, and we recommend using like the pads of these 3 fingers so that you don't get tissue that kind of flips in between there. And then choosing a pattern, whether you want to go up and down or whether you want to go in a circle or you want to do a wedge method, but at least choosing a pattern so that you're covering the entire breast and making sure that you're feeling all the way underneath the arm and even toward the collarbone and up to the collarbone and the sternum, sorry. Because a lot of times, especially if it's if someone has large breasts, they may pick up on something underneath the arm with a swollen lymph node before they could actually feel a breast mass. So picking a same time every month, having a pattern, using the pads of the 3 fingers and kind of laying them flat, making sure you cover all the breast tissue. Also looking in the mirror and seeing if you have any dimpling, if there's any texture changes, if there's any nipple discharge. All of those things can be signs of breast cancer. We sadly see, especially in the older population, sometimes they'll have a little like scaliness or redness on the skin and they want to treat it with some salve or something like that. And because you just kind of think, well, breast cancer, I'm going to feel a lump, but sometimes it can be just a little skin change that can be a red flag for you to have that seen about. There is a really aggressive and fast growing type of breast cancer called inflammatory breast cancer that just changes. You'll see like an orange peel texture on the skin. So just have it checked out if you have anything in question. Typically, if it is a nodule and it's cancer, it's going to be really firm and it's not going to be movable. So if you feel something that's more like a marble, it's hard and firm, then that is, a little more worrisome. And if it's something that's more fixed whenever you're palpating it, or if when you bend over, you're looking in the mirror, you notice that it kind of pulls in a little bit when you lean forward, that's because it's kind of fixed in that place and it starts to pull that tissue in around it. So just better be safe than sorry. I think we already went over this. I'll try to make it real quick. We got 5 minutes left. When to be screened and how to be screened. I did leave some flyers over there about our mammo special. It's actually going on this week. So if you know anybody that's not insured or underinsured that needs to get in and have their mammogram, then it's only $40. And then they can see one of our surgeons for a clinical breast exam for $10. So it's a really great program that we have every October. We were doing it in May and October, but with COVID, we just kind of cut back on some of the crowd. We didn't do it this year. If you get called back for a mammogram, don't panic. It is not unusual at all. If it's your first mammogram, it's highly likely because we don't have anything to compare it to. Every year when you come for your mammogram, our radiologist is going to look back at all your previous images. So if they were somewhere else or they never existed, then they're going to dig a little bit deeper into everything. So it's not uncommon at all. We call back a lot of women for what we call spot views to look a little bit closer. It can sometimes just be like overlapping breast tissue. And we call a lot of women back for ultrasounds, and then it ends up, everything is fine. So if it's the first time you're called back, it can be very scary, and a lot of people get really anxious about that. And our nurses are there to help talk patients through that process if someone is kind of overly anxious about it. It could be one of any of these different benign breast conditions. There are a lot of different changes that can happen in the breast that are not cancerous, and more often it's going to be one of these changes. So just know that if you get called back, it's not always cancer. It's not always actually going to be anything. It could be fibrocystic breast. It could be just a simple cyst, a fibroadenoma, just benign, non-cancerous changes. And then just to kind of cap it off and about where we fit in with our nurse navigator. So we also work with these benign breast disease issues, because so many times, and I don't know if anybody in here has had to undergo a biopsy. I personally have myself. And then till you get that final pathology report, I mean, most women are thinking this is going to be breast cancer, because maybe you've had a scare before, or somebody who's gone through that process who did get diagnosed with breast cancer, but it can create a lot of anxiety. So we do step in and help in those roles. But the big thing that we do is we work with breast cancer patients and their families and navigating them through the process. That is a very complex and can be very complicated to navigate through the healthcare system. You're seeing a lot of different doctors with a breast cancer diagnosis. So you have so many different things to consider. You're talking about a woman's body image and some things that are affected with this cancer type that aren't affected with some of the other cancer types. So we're fortunate to be able to offer that. If you know anybody, or you come in contact with a friend or a family member that needs, if they just have questions, I mean, they're welcome to call us. We can get them connected with, all the local resources and things. A lot of great women in a local support group that we could connect people with. So feel free to reach out to us if you encounter somebody or you personally have an issue. And just know that you have the right to choose. So pick the best place to go and stay there, and know that no matter, sometimes you can get in healthcare tangled up, just being honest in some of the politics and set referral patterns and things like that. But, you have the choice. Everybody is a paying customer, and you have the right to say, this is where I want to go, and this is how I want things to be. And just be aware and be a driver of your own health. I feel like I'm kind of preaching to the choir when I say that to this group, but it's so important to know that you can go where you want to go, and you can be, your own